Hello again, welcome back. I hope everyone's feeling recharged and ready to get involved in more content from our upcoming speakers. On our next panel, we'll be discussing the importance of the NHS meeting sustainability targets in the procurement process. Procurement professionals have an essential role to play in the delivery of NHS commitments to reach net zero goals, as more than 60% of NHS carbon emissions occur in the supply chain. However, when mandatory social value 10% weighting on all NHS procurement came into play in April 2022, many buyers were uncertain about how to quantify this new factor, which questions should be asked at tender, how to score them, the evaluation criteria, and how this new weighting falls in line with other deciding factors such as efficiency and cost-saving considerations. So let's welcome to the discussion Heidi Barnard, Head of Sustainability NHS Supply Chain, Alexandra Hammond, Head of Sustainable Procurement and Supply Chain, NHS England, Alistair Clay, Sustainability and Social Value Manager, North of England Commercial Procurement Cluster, Penny Green, Procurement Director, NHS Commercial Solutions, and Claire Nash, Head of Clinical Procurement, Sandwell and West Birmingham NHS Foundation Trust. Please do carry on submitting questions, and I'll ask as panellists as many of your questions as I can. The little button is on the right-hand side of your screen. So, gosh, what a panel! I mean, going through all of those titles, feel honoured to have you all with us for our first afternoon session. Claire, you've been a registered nurse in critical care for 30 odd years. Tell us why sustainability is so important to you.
Thank you very much for the question. So, I've been a nurse for a long time now. I don't work in critical care anymore, but still really, that's what's driven me to look at procurement and sustainability with the passion that I do. I recognise the volume of single-use stuff that we get through every single day in the NHS, and it's really very acutely aware when you look at what we use in ITU and in the critical care areas, but of course in other areas as well. So that's why, for me, it's absolutely vital that we get the clinical leads on the front line involved in the work that we do in procurement. And mine and my colleagues' role, Janice, is very much about the link between what happens on the wards and departments and what we're purchasing in procurement. And I'm really pleased to say that in our organisations, we now look at the sustainability of a product as well as the quality and the price as part of our clinical product evaluation group. So we really are changing the conversations with the clinicians on the front line about what a good product looks like. And it's really great that we've had a meeting today where that has now been discussed as well. And in fact, it's not me asking the questions about green products anymore. It's the team that come to my meetings, which is great to hear. It's almost like hearing yourself back, which is really great to hear.
Oh, it's great to see, and well done, because I know that you've done a lot of challenges about single use, and you've published papers and really been proactive. So some fantastic stuff being done there. I'm just wondering, my next question was actually for Alexandra, but I can't see Alexandra, so I'm just wondering, Alexandra, are you actually there audio wise? No, I don't think she is she? I was going to ask Alexandra, Heidi, about the Evergreen Sustainable Supplier Assessment, which I was also going to talk to you about and ask you how you envisaged it working at NHS Supply Chain. But I wonder, since I haven't got Alexandra, can you just tell us a little bit about it and what it entails, just in case there are people in the audience who aren't familiar with it?
Certainly. So the Evergreen Assessment was launched in June this year, and it is a one-stop shop for suppliers to talk to the NHS about what they're doing in terms of sustainability. So it asks questions around carbon impact, so looking at scope 1, 2 and 3 emissions, but also goes into some other areas as well, looking at what's going on around waste, around water, around modern slavery, so that it can be that one-stop shop. So rather than suppliers and manufacturers having to talk to every trust individually, it's what they can fill it in once and everybody has access to that information. So that is the kind of the reason and what the tools aim to do. In terms of what
I was going to say, how do you and the team feel about it? And I've interrupted you there, but and how you think it's going to work with the supply chain? What are the benefits you think it's going to offer?
So for me, it's a really powerful tool, because that one of the biggest challenges we get from suppliers is the challenge of trying to talk to the NHS. As people talk about the NHS, but it is not one thing. There are many parts to it, and often suppliers have to navigate that very difficult and complex landscape. Whereas having one point is really beneficial to them. So we really want to engage in that. So historically, we've asked suppliers to complete a carbon waste and water assessment as part of the tendering process and maintain that. And so what we've done as of August is we've replaced carbon waste and water assessment with Evergreen. So rather than getting suppliers to complete both, as in kind of continue with their old requirement around carbon waste and water and also the new ask, we've just wholesale switched everybody to the new ask. And we've given suppliers 6 months to kind of get to grips with it, understand it, and kind of get their details on there. And going forward, that's the tool that we will use to be able to understand where our supplies are. So we can identify who's doing really well and what we can learn from them, but also where are the areas that we need to kind of perhaps give more support and think more about and kind of develop the program around.
Fantastic. Alexandra, we lost you there for a few minutes. So Heidi did a very good job of the question I was going to ask you about Evergreen, and has explained it very nicely to us. But I just wondered how it's going down. We've heard what it does and how it will work with the supply chain, but how are you finding it's been received?
It's been really fantastic. I think we've had hundreds of suppliers register on the platform, so it's integrated into our NHS wide e-commerce portal. So it's called Adamus, so it's part of the procurement process. So anybody working with the NHS is already registered on Adamus and will have that interaction close to hand. So yeah, it's been really well received. I think there's as with every new program you launch like this, there's lots of questions. So we've been running bi-weekly webinars for our suppliers to make sure that they can ask questions and get those answered right away, and also helping our commercial teams in the NHS figure out how to use Evergreen in the most optimal way. So it's gone really well.
Good. Let's bring Alistair into the conversation. Alistair, I was quite shocked to learn that around 60% of NHS carbon emissions occur in the supply chain. So I'm just wondering if you can give us some examples of how you're embedding sustainability and social value into your frameworks and what's been successful.
Yeah, so thank you very much for the question, and hello everyone. So we at NOECPC are one of the regional hubs for procurement, and one of the first things that I did when I joined in April is really to start driving the importance of sustainability and social value through every element of what we're doing, as an extension of obviously the core foundations, the great foundations that we've got from the national team, because that should be the benchmarking for everybody and how they embed it throughout their processes. So the first thing I did was obviously to gain buy-in in terms of the process of how sustainability and social value should be embedded into a framework procurement throughout the entire life cycle. That's one of the first things I did, instead of it just being almost tokenistic, or we need to ask a question here, or we need to consider that. Let's really use it to drive value for not only ourselves, but for the members that we provide for. So, and the next thing I did was exhaustively review all the social value that was committed on previous frameworks to make sure that we're not missing out on anything. And that goes to a lot of NHS organisations that may be present on this call. Please make sure that you're reviewing the commitments that you've had previously, in terms of to make sure you're not missing out on any commitments that the suppliers have made on contracts and frameworks that were already active. But I think, really what we're doing well to start chipping away at that figure is relevancy and proportionality. That, 62% of the emissions are forecast to come from the supply chain. So we need to think about sustainability in a holistic way, in a way of tackling what's relevant in a tender to start chipping with that figure. It might not be, carbon that's the most relevant question. So therefore, what we're doing really well within our organization is taking a step back and thinking holistically, how can we use sustainability better in our frameworks? How can we leverage what's available nationally, and how can we empower colleagues and suppliers to deliver that for us?
Brilliant, thank you. And Penny, last but certainly not least, what have you found challenging when you've been evaluating sustainability and social value in tenders? Because I wouldn't imagine it's an easy thing to do necessarily.
Yeah, I mean, It's been quite interesting. I think it's been challenging in different ways. I think some of it's around what Alistair mentioned about the proportionality and relevance, and making sure that you're still compliant with our PCR legislation, because some areas are much easier than others to tie it to. So waste, construction, it's easier to make it relevant, but some of the others, you can be sitting there thinking, if I'm going to give away 10% of my evaluation criteria, how am I going to make this so that it's actually adding some value to what we're putting in place? So I think making sure that you're asking the right questions for the market that you're working with. I think if you've got a litigious market, it's particularly difficult. So I think being very careful about subjectivity, because if it's litigious, you're going to have a more difficult time trying to back up what you've chosen to do. I think there's also, if you're going to make meaningful impact, what does that mean for what you're buying? So is it a short-term arrangement you're putting in, or a longer term, and how are you going to make sure it's relevant throughout the contract duration, not just at tender to get the right supplier in, and that you've got the resources to be able to make sure that you put that in place. And as we're seeing more challenges as well, I do wonder sometimes whether or not, there is going to be a bit more of inquisitiveness about, particularly in markets where there's very tight scores, if the sustainability and social value was actually the differentiator, making sure that we don't do the let and forget. You put a great tender in, you do a good evaluation, and actually, is it being delivered at that contract stage, and how can you make sure it's being delivered and that you can see it? So I think that for me, those are the main ones, and tying some of what we're asking into that maturity of both procurement and contract management to make sure that you can actually have real progress towards the goals that we're all trying to achieve. But it's quite difficult.
I'm sure it is. And I just wonder if while you're there, Penny, I can just give you Dan's question. You've touched on a little bit of this, but Dan's asking, he's got two questions. He says, when will there be a national database of suppliers who meet the basic criteria of meeting or exceeding NHS net zero carbon targets? And what happens when suppliers just don't adhere to NHS supply chain criteria after 2030? I mean, two fairly big questions there, but...
Yeah, I mean, if I could take the last one, I think that's about baking it into either frameworks, as Alistair was mentioning, or the actual call-off contracts or full market tenders. It's about baking it in, because it's not just the evaluation. You can put things in specifications. So quite often we've hard baked in the NHSE toolkits or targets into the specifications to say that we want to see the continuous improvement during life cycles. So I think... I think that's where, if they're not adhering to it, I think that, if there's minimum requirements, and that's a question, isn't it? It's how relevant is it, and how is it proportionate and relevant to actually say, if you had a waste contractor who wasn't doing sustainability, I think you would probably be able to exclude them because it's so key. So whereas if it's a bit more subjective, maybe that's a bit more of a discussion, or whether or not the supply market needs to develop. I think in terms of the when we'll see the suppliers, I think that's around the traction with those NHSE central tools, and I think those are really important, so you don't have a myriad of 101 different tools out there that suppliers are having to do. If we try and tie in together, so there are these sort of ongoing self-assessments, that's where we can start really seeing and tracking where the supply bases are. And I can think once those tools are really getting properly embedded, then they can be part of procurement requirements and tendering requirements to say, are you on them or not? But we have been putting them in to say we would expect them to be engaging with those tools. But yes, we're depending on the framework or the tender that we're doing, we're having different levels of assertiveness on that, I think I'd probably say.
Good way. Claire, I know you've lived and breathed sustainability for a long time before it became...
I'm so sorry, Helen. Can I just come in on a couple of... it's really... and I really don't want this to pass by. Yeah. I think there's a couple of things. So the NHS requirements are outlined. They're set out in the Net Zero Supplier Roadmap. They're very clear. And Penny's absolutely right. As if suppliers don't engage with those and they don't meet the minimum criteria around those requirements, so having a carbon reduction plan for, at the moment, contracts of £5 million per annum and up, and that will continue to get more ambitious over the next few years, then they won't get through the procurement process. So that's an important thing to really point out here is that this isn't sort of there's separate things around the minimum weighting of 10% social value in procurements, and then which is a requirement for all of us to include, but it's also there's really clear milestones within the Net Zero Supplier Roadmap that set out a very, very clear path for what suppliers need to do. And if they don't do it, we'll work with them. We'll make sure they have as many bits of support as possible to get there. But if they don't join the Net Zero journey, the NHS over the next few years. And then I also wanted to say, Dan asked a question around when there will be a national database of suppliers who meet the basic criteria of meeting or exceeding NHS carbon targets. That's evergreen. That is evergreen. 100% evergreen. It's here. It's arrived. So that's why we created it.
Thank you. And I'm not sure actually whether this is you, Alexandra, or whether somebody else can pick this up. But Amy's asking, would you measure sustainability via KPIs? And if so, how do you do this? I don't know who feels they can perhaps answer that for us. Any offers there?
I mean, I think we can probably all answer that. Absolutely, right? I mean, if we're not measuring with KPIs, then we're not going to be measuring. So it's really critical. And so as part of the, certainly as part of the social value model, which we've adopted, you know, it is good practice. It is to include KPIs within the tendering process to then be able to measure, you know, like Alistair and Penny have both mentioned, the huge importance that's in the contract management. So absolutely, the key performance indicators are critical.
Thanks, Alexandra. Claire, we haven't heard from you for a while. It's always tricky when there's five on a panel. I always feel that we kind of leave somebody at the end. But Claire, you've been sort of head down on sustainability for a lot longer than perhaps, you know, some of the world have been talking about it. I know you've been really invested in it all. I'm just wondering, you know, what these days keeps you awake at night?
I think it's absolutely fantastic that we've got so many people on the chat that want to learn about what to do differently. But what keeps me awake at night is the lack of political will to support the move, because we are 4% of the carbon footprint. That's what we can influence, but we can't influence the bigger picture. I obviously don't want to get too political, but I have to say that because you've asked me what keeps me awake at night. That definitely does. I think the other piece really is, how do we mobilise the workforce to deliver in this really, really important topic? They are pulled in so many directions, and we know the workforce is challenged significantly at the moment. So I think the other piece for me is, how do we get more staff at these sorts of events to understand what it is that they can do? What can they do differently when they go to work tomorrow that will impact what we're trying to do as a collective from an NHS procurement perspective? And I think that the work's happening. There's a lot that NHS England are doing. There's a lot that we're trying to do around education for student nurses, and certainly in post-reg courses, the education's coming. Because generally you ask somebody what they want to do and they talk about recycling bins, and it's important, but that's not going to fix it. So how do we educate our new staff and our current staff to really want to come along and do the work with us, because we can't do it on our own?
No, we certainly can't. I mean, Heidi, I know that you've been in the post, I think almost exactly a year now in this particular post. And what are the key changes that you feel that you've brought into the programme, and in a way, what's keeping you awake at night? Because what are the next big priorities that you see having been there that year?
Well, so for me, looking back at the last year, I think the things that have changed over the last year is the collaboration and beginning to bring the parts of the puzzle together. And for me, that is an enabling piece for what we need to do next, and to tackle the thing that keeps me awake at night, which is the breadth of what we need to look at. If you think about the kind of the journey we're going on and the things we've kind of alluded to, we've talked a bit use items, we've talked a little bit about reusables and commodities, but the breadth of what we procure is enormous, and you can get overwhelmed with it if you're not careful. So it's how do you kind of break that down and think about, right, what do we need to tackle? What are the short-term, medium-term, long-term approaches to this? Because not everything is going to be a one-size-fits-all approach to fix it. And actually, the growing community that we've got around this, we're all trying to pull in the same direction. We all want to achieve the same things. And how do we leverage what we've got to make sure that we're not duplicating effort, that what we're doing supports each other and builds on what we're trying to achieve?
Yeah, and collaboration is always so key, which leads me on quite nicely, Alistair, to ask whether you've got, some tips for NHS organisations on embedding sustainability and social value into their procurement practices, because I think it's so important, isn't it, to continue those conversations and share what's worked, share the challenges, share how you've overcome them.
Yeah, it's a really good question, and I think the biggest challenge I think we have in sustainability, and I'm sure everyone sees this, is sustainability tends to be seen as that's sustainability's job. So I think empowerment's a real key here. In terms of tips that I would give for other NHS organisations, you have to view sustainability as a real must and something that has to be tackled in the short term. Not, we'll tackle it in 2050, or we'll take what suppliers are saying about what they're delivering in the future. This is about empowering resource within your own organisations, as we've done at NOCPC, as NHS England have done, as I know Claire's doing in Black Country. So it's a case of empowering others to really drive the agenda, but also making it part of everyone's day-to-day lives. And I know that's quite cheesy in the way of saying it, but everyone's day-to-day roles, but everyone can play a part in this. You look at, a procurement process doesn't just happen with procurement. It touches on every different function within an organisation. So actually, it's a really good way to drive sustainability and social value within that. I think KPI conversation was a really good goal. What is it that we want to achieve as an organisation? How do we achieve that? And how do we leverage, especially in this conversation, procurement to realise that? You cannot tackle anything in sustainability without tackling your supply chain first and foremost, or having an idea of how you're going to do that. So I think it's really, really key to understand, okay, especially for NHS organisations writing their green plans, they will have to have a think about what they're doing with their Scope 3 emissions. And there was a good webinar on that earlier today, if anyone caught that, from Alexandra and her team. So yeah, I think it's really empowerment with my biggest thing, and making sure that it's just not seen as sustainability's role here, and really, carving out your own journey and think about how you want to get to, and then breaking it down, because it can be seen as quite an overwhelming task at first. How do we tackle sustainability? So that would be my response.
I think we all have to just, away from the NHS as well, we all have to just live and breathe it as individuals. This is the situation we're living in now. Our planet's in, climate's in crisis, and it feels sometimes such an enormous problem. But then when you think about the difference, if everybody tries a little bit, that collective difference is huge. Alexandra, I'm just wondering, what your next big priorities are.
So, I mean, like Heidi says, there's such a breadth to what we're trying to address here, and so there's and not breadth. There's depth. We want to not just tell people to do social value and net zero in procurements. We want to help them to do that well. So I think for us, we have some milestones coming up. So we've got our 2024 milestones. So we'll be publishing guidance on what that will look like for suppliers and also for NHS teams. We will continue to mature our approach to social value in procurements. So over the summer, my team ran a series of workshops with industry and also with NHS colleagues to talk about what's working well on our inclusion of net zero and social value, what we can do better, what resources we need to improve. And I really want to put some focus on building that community of practice and making sure that we are getting the best out of our suppliers when we put these questions in. I think it's really, really important. And then the other really big thing is Evergreen, really kind of building that into the way that we have a conversation around sustainability in healthcare, and using that as a collective voice to understand where people are on that journey and to hear what our suppliers are doing. Because Evergreen recognizes the minimum but it also recognizes the best practice and the really outstanding things our suppliers are doing too.
Penny, we all know that we're living in a time of, steep inflation and massive price increases, and I just wondered if that's had an impact on trying to progress the sustainability agenda.
Yeah, and I've actually just seen, I think Neil Hines asked a similar question about.
Yeah, well, that was my follow-up. Shall I read Neil's
sorry.
as well?
Yeah.
Well, I'll just read to the audience Neil's question, which kind of inspired the question too. But Neil's Hind, who was on a previous panel for us this morning, said, is there a risk that increased focus on efficiencies in-year savings will detract from sustainability programs and initiatives? So I guess you can weave that in perhaps to your answer if you would.
Yeah, I mean, I think there's a potential, makes it a bit more difficult in some instances, but I think it also can help instigate the need to apply some of the sustainability initiatives like demand management and really reviewing, do you need to be doing this? Do you need to be doing as much of it? Is there waste in the process? Can have huge savings. And, certainly within procurement, contract management's coming much more to the fore, not just on one category, but interdependent categories. And I think that can get very exciting. We've done initiatives on, MFDs and how much people are printing and benchmarking within the region. And we picked up about £1 million worth of savings that might be in the system, partly through different rates, but also through demand management, where, some trusts had been, more effective at getting the amount of printing down. So some of it's about how are the conversations being instigated to ask, who's doing what and is it working? Or also importantly, where's it not working? Let's not waste time making the same mistakes. I think also, the difficulty at the moment is everyone is so pressured. The time to make strategic decisions and proper planning is a bit more constrained, but actually stepping back, should we be doing the same thing again? Should we be doing it differently? If we're going out to the market, doing options appraisals, and actually, some of the spend to save initiatives really, like we've done 6 facet surveys on estates to actually really do a more strategic program rather than an isolated project. So I think some of those can help, but certainly avoidance. We've recently done an international recruitment framework, and actually from our intelligence of what was happening previously with all the call-offs on the previous one, there was a lot of flying out not for the candidates, but actually all the interviews and meeting the providers who are doing the international recruitment. So doing that digitally, sometimes it's quite quick, easy wins are in there. But yeah, and I think indexing, it's key. If you're coming in to do a big project at a time when the price is high, you need to be able to. So indexing isn't just about capping your price increases. Are we looking at where the price is coming down and making sure we're actually applying that? So there are lots of things around contract term as well. Do we need to do them for as long? Sorry, just as a last point, I think also I'm quite interested. I used to work in private sector in my earlier days, but how are we partnering with suppliers? Because could we be a bit more innovative about ring fencing our arrangements with their profit, with transparency on the contracts, protecting that profit, and then they partner with us to bring the rest of the costs down, or how that can be done, because then their profit is not at risk. I know that's a little bit more tricky of how you put that into a tender fairly in public sector, but maybe that's something that we need to start looking at as we work more in partnership with suppliers, so that they're not, because if the pricing goes up and they're on a percentage, then they gain, don't they? So it's about trying to protect and work together, because we're all impacted by the sustainability initiatives, aren't we?
Of course. I knew Claire would have a hand up there, because I know you've been balancing savings with sustainability where you are, Claire.
Yeah, definitely. Yeah. And I think I'd echo what you said, but I just wanted to give a few examples of where we've been able to save money because of the green agenda. So we've been looking at how we reduce single-use plastics. And it's not just about reducing use, but questioning why we're using them in the first place. So there's a couple of things that one of the things we've been able to get rid of altogether in one organisation, which is scrub brushes. There's very little evidence that a scrub brush actually makes your hands more decontaminated than just washing them normally. So we've got rid of those. That saved significant carbon and money. Couch roll, what on earth are we doing putting couch roll on a bed, because you're going to clean it down between patients anyway? So what is the value of that? And we looked at that because of the cost pressure that we were facing. So we've reduced couch roll. Gloves, of course, is another one that we use too many of. So I think there's a lot of examples where if you look at your green plan and what you want to do from a clinical perspective is deliver the best care that you can, and that's got to be evidence-based. And where there isn't any evidence base, then we can refuse to use some of this stuff as well, which of course is better for patients, for the planet and the public purse.
Yeah, really good quick wins. Heidi, I know that you might only be a year in your job now, your current role, but you've got 2 decades worth of experience in sustainability. What kind of learnings have you brought with you, do you think, from other sectors that you've worked in?
Big question. I think it's the flexibility of approach and the fact that there is a lot of crossover. We're not reinventing the wheel here. We are, like every industry, on a journey, and there are cross points of contact in every industry. So when we start to think about some of the products that we procure, other industries procure them, that some of those industries are much further along in the journey. So what can we learn and what can we take and just implement? Particularly with things around thinking about material scarcity. And if we think about some of the products that we procure, what's the material scarcity and volatility like in those markets, and how can we learn from other industries that are able to react better than that than we are? And what benefits have they seen from that, not only from a resilience perspective and from a cost model perspective, but from a sustainability perspective as well?
Brilliant. And just going slightly over, because I've spotted another couple of quick questions. Alexandra, I don't know whether you can take this one. Hannah's asking, how are small and medium-sized companies evaluated fairly compared to larger organizations who may have a large budget and extended resource for sustainability? Is that anything?
Yeah, it's a good question. And I think we're really conscious that, not all suppliers have a resource here. Well, there's a number of things that our team is doing, including supporting small businesses through some additional webinars and other resources. But I think, one of the things that we are really conscious of is ensuring that our small businesses remain a really critical part of the supply chain. And we want to recognize that that they work as part of the process of evaluation. And so this has been a really important theme in the work that we did over the summer around recognizing how small businesses can contribute to our work in development. And I think one of the reasons that putting social value into procurement is tricky to get it right and to get it to really allow it to be a way that we can get something really positive and meaningful out of it. And I think one of the things that we really need to focus on and not get complacent is how we draw out what small businesses can offer that perhaps other larger businesses aren't able to. And so I think that it's definitely something that is on our radar. It's if you didn't ask me the question, but it's one of the things that keeps me up at night. We really want to support small enterprise and companies, and so we do a number of things. Like we have the SBRI, which is the Small Business Research Initiative, where we fund emerging companies with great ideas to do net zero activity. It's really about finding that route to market and supporting them along the way.
And just finally, because I have gone 4 minutes over, but Penny, I just wanted to touch on modern slavery being high on the agenda and NHS Trust now needing to prepare statements. And how can procurement and supply chain contribute to those statements, do you think?
Yeah, it's quite an interesting one. So before I joined the NHS, I was actually in the higher education, and we were required to do a lot of the statements at that time. And I think some of the observations I had from that point was it was almost being seen as a policy internally rather than a progress report. And actually a modern slavery statement is more of a progress report. It's where are you and what are you going to do next? And then the next year you're saying, and how much did I do with that, and what am I going to do next? So I think for me, it was around trying to influence internally. So it's almost coming up with what's our vision, what's our plan. But it was also trying to avoid some of the statements in there, which was we aim to not have modern slavery in our supply chain. I was always told if you think you haven't got it in your supply chain, you just haven't found it yet. So it's around actually what are you doing to work proactively with your supply chain to make sure not just your own staff and team are properly trained up to understand how to incorporate it, but also how are you helping and supporting your supply chain? And that goes into the modern slavery assessment tools and all of that. So, but there's lots of quick wins in there. Actually, just putting the statement on the front page. There's some things like that, and training. I always remember I was finding it difficult to get people engaged. They were almost just seeing it as another thing they had to do. And then I got them sat down and made them watch films of it in real life, what was happening. Suddenly they were like the biggest champions. They were actually trying to go quicker than I could deal with because they'd got so passionately involved. And it's actually, when you see them, it can feel quite daunting. So I think for me, it's one of the joys of being in public sector is you're not on your own. It's not just one trust or one small organization. We can team up. And actually, if the NHS teams up, even just across the NHS, but also across wider public sector, you can have a huge impact if you think how much we're doing. And I think even on things like on a wider thing, actually, if you've got any company that's doing a service, they should train their staff because they might spot it. They might actually be able to spot modern slavery happening. So I think there's quite a lot of dimensions of how it can be brought into play.
It's a good place to end because popping up on my screen, there's lots of little thumbs up and love hearts. And there has been actually a lot for all of you. So you've been wonderful guests. I feel we've had lots of learnings there. Thank you so much for your time. And I'm sorry the panel went slightly over, but massive thanks to Heidi, to Alexandra, Alistair, Penny and Claire for a great discussion on what really needs to be done as far as sustainability goes. We're now going to take a final break. Please make full use of the speed networking function as this is your last opportunity to do so today. I'll see you at 3:10.
So is this a